Good morning, and welcome to the NMG and Discovery Health presentation on the updates for 2025. My name is Dominique Ortoni from NMG Benefits. This session highlights and summarizes the various options available on Discovery Health, with particular reference to the changes in benefits and contributions for 2025. NMG is an authorized financial service provider, and NMG staff are fully accredited with the FSCA and the Council for Medical Schemes, as well as your medical scheme. As one of the largest financial services intermediaries in South Africa, we can assist with various elements of your medical scheme and provide you with independent advice on the most appropriate options. Today, I'd like to welcome Zane Khan from Discovery Health, who is assigned to the Western Cape NMG corporate portfolio, and he is going to take you through the updates for 2025. Should you have any questions, feel free to ask them in the Q&A section, and these will be answered during the session or directly after the session. Thank you, Zane. I'm going to stop sharing. Please allow for some time for us to switch presentations.
Good morning, everyone. Thank you so much, Dominique, for that introduction. As Dominique mentioned, my name is Zane Khan. I am the Corporate Health Manager for Discovery Health Medical Scheme. Today, I'll be taking you through some of the updates for Discovery Health Medical Scheme benefit enhancements for 2025. There are a number of slides to get through, and I'll try and be as efficient as possible. But please feel free to use the Q&A to pop in any questions you might have, and we'll try and take that as we go along. To get started with any Discovery Health presentation, we usually begin with our core purpose, which is to make people healthier and to enhance and protect their lives. You'll find that a lot of our products and benefits stem from this core purpose, and you'll see that manifest in today's presentation as well. There's really 5 themes that I'll be talking through today. We'll be going through the financial stability of the medical scheme industry, as well as Discovery Health Medical Scheme. I'll be introducing you to a brand new product called Personal Health Pathways, which also ties into an additional day-to-day benefit that we are making available to all Discovery Health members in 2025. I'll touch on some of the rich benefits available to our members, and then take you through some of the service experience, as well as the integrated products and lifestyle benefits like Vitality. The first slide that I've included in this presentation today is actually this data is from the Council of Medical Schemes. So the data isn't specific to Discovery Health. It looks at the industry as a whole. What you're looking at on the left-hand side of the screen is the growth rates from 2014 up until 2022. This is growth rates, but you can actually see that there's been a decline in the number of lives within the open medical scheme. At the bottom of the left-hand side of the screen, we've also seen a huge reduction in young professionals. Between these years, the amount of young professionals within the open medical scheme has declined significantly by almost 85,000 lives. And we definitely think that there is an opportunity to create products that attract these young professionals back into the open medical scheme market. In the center of the screen, we've given you a view of the demographic risk. Very simply, the scheme is aging year on year, and between 2019 and 2022, we've now gone up to an average age of 35.8. This has an automatic impact on the chronic ratio, or the number of members registered for chronic conditions, and we can see that at the bottom of the screen going up to 26.3%. This in turn has an impact on utilization, and we can see that hospital admissions have increased significantly. Cancer claimants going up by 13.3% between 2019 and 2024, a significant jump there. And at the bottom of the slide to the right-hand side of your screen, we've given you an indication of the tariff increases that we've been seeing. So tariff increases is basically the rates that your specialists would charge, and we can see those increases illustrated on the bottom right of the screen as well. So that's really the industry stats that we've included in this presentation for you. I'll be going on to Discovery's performance over the last year. Starting on the left-hand side of the screen, Discovery has been independently rated as the most sustainable medical scheme in the open medical scheme market. And you can see how we compare to the other 8 or 9 big medical schemes within the country. We're in a very strong position. Our reserves currently sitting at 27.2 billion rand, solvency at 30.6%, which is actually 5% higher than the required solvency rate within the country. And we also have a AAA credit rating, giving you the peace of mind that your claims will be paid when you need it the most. In terms of market share, Discovery still holds the majority of the market share within the open medical scheme industry in this country. We're currently sitting at just under 58% of the market share, and you can see on the left-hand side of the screen how we compare to some of the other big open schemes within our country. In terms of stability, that 95.7% in the middle of the screen indicates the percentage of members that have not made any changes to their plan choices over the last year or two. Just, indicating that the members have made plan choices and have stuck to those plans, which shows us that the benefits and price points are working for these members. On the right-hand side of the screen, we do see members leave Discovery Health Medical Scheme for lower premiums or for other benefits, but the research shows that 1 in 3 members return to Discovery Health Medical Scheme within 2 years, with an 8-month average time away from Discovery Health. This really brings me to the contribution increases for next year. This news isn't brand new. We have announced these increases about 2 or 3 weeks ago, but it is important that we walk you through these price increases. The 9.3% weighted average increase you see in the right-hand side of the screen is really the average across the different plan types. So no one will actually experience a 9.3% increase. The increases are, they differ according to plan type, and you can see that they range from 7.4% all the way to 10.9%. And really the biggest contributing factor to this is the different levels of utilization according to the different plan types. On the right-hand side of the screen, we've given you a comparison of how Discovery Health Medical Scheme compares to the other schemes that have also announced their price increases for next year. And you can see that Discovery Health Medical Scheme coming out on 9.3% average in comparison to the rest of the industry. We have managed to keep our contributions slightly lower. And then we've also done a comparison against the next 7 largest open medical schemes in the country. We've really compared like-for-like plans. And what we find is when you compare like-for-like plans, our contributions for principal members is 11.1% lower than the next 7 largest open medical schemes in the country this year. So significantly competitive rates when you compare like-for-like plans with the next 7 largest open medical schemes. And that really is the first section of this presentation. Again, the Q&A function is available to you to send any questions or comments that you might have. Going into the next section, I'll be introducing you to a brand new product called Personal Health Pathways. Personal Health Pathways will be made available to all Discovery Health Medical Scheme members, regardless of the plan that you're on. And it really is a precise and hyper-personalized healthcare pathway to guide and reward our members to a healthier lifestyle. Personal Health Pathways really stems from the data that we've accumulated over the years. As you can see on the right-hand side of the screen, Discovery has 60 million life years of data, including additional data that's been added on from our very successful Wealth Fund benefit that we launched in 2023. This essentially means that members have more than 7 million possible personal health pathways. And really the idea with personal health pathways is to guide and help our members to prevent and reduce chronic disease. Now, the screen looks very complicated. There's so many different sort of pathways for a member to choose to sort of improve their health. But really with personal health pathways, we aim to simplify this process for our members and reward them for this behavior. So personal health pathways will provide each member with a unique health action. The health actions that each member will receive will be based on their unique health status and their engagement with Discovery Health Medical Scheme. When members complete these health actions, they will be rewarded with dynamic and hyper-personalized rewards, and we've gamified the user experience to help members navigate the platform a lot better. The objective with personal health pathways is to improve the health and longevity of our members. Personal health pathways will manifest in the Discovery Health app. On the left-hand side of the screen is the actual view of what personal health pathways looks like on the Discovery Health app. You'll find that you have two rings. The ring on the inside with the honeycomb will represent your health ring. The health ring really encourages completion of clinical actions, screening and lifestyle actions. And then the ring on the outside is your exercise ring, very similar to Vitality Active Rewards. For those of you that have the Vitality product, the exercise ring will encourage you to complete a certain amount of steps, exercise, and fitness actions. Once you complete these next best actions, you close your rings automatically. And as soon as you've closed your rings, you will be given an instant reward. The instant reward you can use immediately for a coffee or a smoothie or a voucher to use with one of our partner stores. Or you can choose not to use the instant reward, and then it turns into a game board play, which allows you to win Discovery Miles. In addition to the instant reward and Discovery Miles that you will receive from closing these next best actions, we are introducing a brand new day-to-day benefit called the Personal Health Fund, where you will now start accumulating funds, which you can then use to pay towards your out-of-hospital medical expenses. I'm going to talk about the Personal Health Fund in more detail shortly, but before I get there, I also just want to highlight that the personal health pathways will be available to members on the Discovery Health app. So you'll need to download the Discovery Health app in order to use this benefit. If you're a Discovery Bank member, this benefit will be available through the Discovery Bank app as well. And we've also identified a cohort of members who are not digitally engaged. And these members will be receiving an invite via WhatsApp, and they will be able to activate the benefits and make use of the rewards through the WhatsApp function as well. So as I mentioned earlier, the health actions will be unique to your health status and engagement patterns. We've given you two examples here of what health actions one can expect to receive through personal health pathways. On the left-hand side of the screen, this is an individual who's moderately active, is 28 years of age. He doesn't have any chronic conditions. And some of the health actions he may need to complete, as you can see on the screen, is selecting his GP online, completing a health check, completing an online assessment. In comparison to the individual in the middle of the screen, she's a 55-year-old lady. She has been diagnosed with a chronic condition, and you can see some of her health actions is a bit different to his. So she might need to collect her chronic medicine. She might need to visit her GP, go for a mammogram, and so on. So the health actions are really unique to your health status. Also important to note, although we've given you quite a few examples on these slides, you will only have 2 health actions that you would need to complete at a time and 1 exercise action. So these are just examples, and that's why there's a large number of them here. But at any given time, each individual will have a maximum of 2 health actions that they would need to complete and 1 exercise action. And that really is personal health pathways. I did mention that by completing these health actions, in addition to the instant reward and Discovery Miles that you would receive, you'll also start accumulating funds in the personal health fund. And now I'm going to talk a bit more about the personal health fund. The personal health fund is going to form part of your core benefits. So if we look at that pyramid, you can see the hospital benefit forms part of the core benefits, chronic illness benefits, screening and prevention, and now the personal health fund is also going to form part of your core benefits. So this essentially means that it will be available on all plan types. So regardless of the plan that you're on, you will be able to accumulate funds in this personal health fund. The benefit is linked to personal health pathways. So again, in order to access this benefit, you will need to download the Discovery app and activate personal health pathways. In the center of the screen, the table gives you a view of the limits that apply to personal health pathways according to the plan type as well as family size. You can accumulate up to 10,000 Rand per policy based on your plan choice and family structure. I'll use myself as an example. I'm on a classic smart plan on the center of the screen. It's myself, my wife, and I have 2 kids on the membership as well. So essentially, between the 4 of us, we could potentially accumulate 6,000 Rand through the personal health fund, and we can then use that for any day-to-day medical expense. So how do you accumulate funds in the personal health fund? Very simply, each time you close a health ring, you'll accumulate 500 rands towards the fund. Each time you complete a exercise ring, you'll accumulate 100 rands towards the fund. If you've got kids on your membership, kids are not required to complete any health actions, but as soon as each adult member on the policy completes 2 health actions, the kids portion becomes available to you to use. Important to note, once you start accumulating funds in your personal health fund, you can use these funds for any day-to-day medical expense. Similarly to how your medical savings would pay for a claim, your personal health fund will now come in before your medical savings and pay for those claims. If you're on a plan like a key care plan or a smart plan that has risk-funded benefits, your risk-funded benefits will apply first before we start using up your personal health fund. But if you're on a plan with a medical savings account, then your personal health fund comes in first before your medical savings account. Any member on the policy can use any part of the fund. So regardless of who's completed a health action and contributed towards accumulating these funds, any member on the policy can use any part of the fund. And these funds do need to be used within the same calendar year. So they don't carry over into the next year if you have a balance still remaining by the end of the year, and the funds reset on 1 January each year. New members who join Discovery Health Medical Scheme from 1 January 2025 have the ability to double their personal health fund. The difference with new members is that when they activate the personal health fund, they'll find that they have a high value tile action that they would need to complete within 90 days. Once each adult completes the high value action, the additional funds become available to them. They can then go on to complete their health actions for the rest of the year to accumulate the balance of their funds. If you are a new member who's joined Discovery Health Medical Scheme in 2024, and if you've activated your wealth fund benefit this year, if you have a balance at the end of the year, it will carry over into the next year. I think that's just important to note for anyone who's joined in 2024 and you've unlocked your wealth fund benefit this year. And then again, just to emphasize, the personal health fund is going to form part of your core benefits. So you can expect to have this benefit available to you year on year. We've given you an example of what the personal health fund, how it would play out. In this example, Tsepo is on a classic saver plan. It's himself and his wife on the plan. They are new members. They join in January 2025. So when they activate their personal health pathways, they find that they have high value tiles, which they need to complete within 90 days. They each complete their high value tile action, and by doing so, They've now unlocked 2,500 Rand each. They have a balance of 5,000 Rand available in the personal health fund. They go on to complete additional health actions, and they've accumulated an additional 1,000 Rand. So they now have 6,000 Rand available in the personal health fund. Tsepo visits a physiotherapist. The physio submits a claim through to Discovery of 1,150 Rand. This automatically pays from the personal health fund. They have a balance of 4,850 Rand available to use for additional day-to-day claims. And I think here the important thing to note is that when you start accumulating these funds, the claims will automatically pay from your personal health fund opposed to your medical savings account. So the doctor who's submitting the claim doesn't have to inform us that it needs to pay from a specific fund. It will automatically pay from the personal health fund, which will be available on your profile. And that really is the personal health fund. Again, please feel free to use the chat function if you have any questions on those benefits. I'm just going to touch on some of the benefits across our plans and the different network plans. So I did mention the core benefits that you see on the pyramid, which includes your hospital benefit, chronic benefit, personal health fund, and screening and prevention benefits. So I thought it would be a good idea to give you a view of how your hospital benefit worked for you last year. What you're seeing in the center of the screen is Discovery Health Medical Scheme's cover ratios versus the industry cover ratios. And the 96.1%, it represents the percentage of claims that we've paid out for members who were admitted into hospital last year. So essentially, with all the members, all Discovery Health members who were admitted into hospital and the claims we received, we paid 96.1% versus the industry, which is at 90.6%. This essentially means that Discovery Health Medical Scheme members received 3,260 Rand additional cover per in-hospital admission compared to the industry. On the right-hand side of the screen, we've given you a view of some of the highest claims we've paid out or in-hospital claims that we've paid out in the last 12 months. I'm not going to go through all of them, but you can see some really high claims. The one that I usually like to touch on is towards the bottom there, the 5.7 million Rand paid out for a newborn baby who needed major surgical procedures. And I think this really speaks to why we have medical aid cover. And I think this also talks to our strong reserves and the fact that we are in a position to provide our members with this level of cover. And then some of the new benefits we've introduced, starting with the disease prevention program. The disease prevention program really comes in before someone is diagnosed with a chronic condition. So this is a very proactive program, and it seeks to identify members who are at risk of developing cardiometabolic syndrome. Very simply, when a member completes a health check at a wellness event or at a Clicks or a Dis-Chem, and when that member has 3 or more of his health check results that are out of range, this is an indication that the member is at risk of developing a cardiometabolic disease in the future. So these members who are identified at risk will then proactively be contacted by a health coach who will advise them of their eligibility to join this program. With the member's consent to join the program, a basket of care will be made available to the member. This program runs for a period of 12 months. And during this 12 months, the members will have access to this rich risk-funded benefit where they'll have GP consultations covered. Coaching sessions are also covered from this benefit. Dietitian consultations are included as well. And where a member requires prescribed medication, this will also fund from this basket of care. After the 12-month period, if the member is at a controlled level of risk, they will exit the program. But at that point, if there is a chronic diagnosis made, then the member will be registered or enrolled onto the chronic illness benefit. Thereafter, the PMB basket of care becomes available to the member. So again, this program, it's really coming in before an individual is diagnosed with a chronic condition, and it seeks to support members in reducing their risk of being diagnosed with a chronic condition. But if a member is diagnosed with a chronic condition, then we obviously have the chronic illness benefit that'll come into play, and I'll talk on that a little bit as well. In addition to the disease prevention program, we've also introduced a brand new depression risk management program. Again, with this program, it seeks to identify members who are at risk of being diagnosed with depression. Also, a very proactive approach, members who complete the clinical assessments and then are identified at high risk of developing depression, they will be contacted by a health coach, advised on the eligibility to join the program. With the member's consent, we'll activate the basket of care. This program runs for a period of 6 months at a time. During this period, members will have access to a consultation with a Premium Plus GP or a psychologist, virtual coaching sessions, consultations with a dietitian. Digital therapeutics will be made available to these individuals as well. Once the program has run its course, if at that point a member is diagnosed with a mental health condition, then we will enroll them onto the mental health care program, which is also a risk-funded benefit. And during this time, the member will have access to additional consultations with a psychologist or Premium Plus GP. Antidepressants is also covered from risk through this benefit. And we've most recently partnered with a company called SilverCloud, which provides digital therapeutics to members registered on the mental health care program as well. So again, the depression risk management program seeks to identify members before they are actually diagnosed with a mental health condition and give them that support to sort of prevent the diagnosis. But upon diagnosis, we will activate the mental health care program. And then I did mention this a bit earlier, the chronic illness benefit does form part of your core benefits, so it is available on all plans, regardless of your plan choice. The screen here, I've just given you a bit of an indication of the chronic prevalence over the years, and we can see that chronic ratio increasing significantly. We've included the top 3 chronic conditions, and since 2015 to 2023, you can see the percentage increases for each of these conditions. Cardiovascular disease increasing significantly. On the right-hand side of the screen is a view of some of the chronic claims, or the amount that we've paid out from the chronic illness benefit in 2023. And I'm not going to go through all of them, but you can see that in 2023, we've paid out 3.4 billion Rand in chronic illness benefit claims alone. The chronic illness benefit covers you for 27 chronic conditions, and this is covered on all plan types. If you are on a classic comprehensive or executive plan, you do have access to additional conditions that are covered on those plan types. But important to note, the chronic illness benefit is not an automatic benefit. So if you are diagnosed with one of these conditions, then your doctor would need to apply for cover. And once your cover is approved, you then have what we call a basket of care, which will become available to you. This basket of care covers a certain amount of chronic consultations with your doctor. Certain tests are covered from risk as well. And then your chronic medicine is also covered from this benefit. Discovery does have a chronic medicine list. So if your doctor prescribes medicine that's on this list, we will cover it in full. But if your medicine is not on the list, then we cover it up to what we call a chronic drug amount, which is a set rand amount. And if your medicine costs more than that, then you would need to pay the difference. There are instances where the doctor might not want you to take medicine that's on the list. And in those cases, your doctor will need to submit a motivation to request full cover for the medicine that he would prefer for you to use. So I spoke to you about the disease prevention programs. I've just spoken to you about the chronic illness benefit, which comes in when a member is diagnosed. We also have what we call chronic care programs. These are condition-specific care programs for diabetes, mental health, HIV, and heart conditions. And really what this does is, in addition to the basket of care that becomes available to you when you are diagnosed with a chronic condition, by activating the chronic care programs, you have additional cover. So you have additional consultations with dietitians, with biokineticists, Psychotherapy sessions are included in the mental health care program as well. Additional cover for prescribed medication. So it's really additional support and also coaching that is provided to you as a Discovery Health member when you are registered for one of these chronic conditions on the chronic illness benefit. The cardio care programs can be tracked through the Discovery Health app, and it can also be linked to your doctor through Health ID, who will then be able to more closely monitor your condition and provide you with that additional support. We've made a few enhancements. The first enhancement is to the maternity support benefit. What we've done here is we've partnered with a company called Parent Sense. Parent Sense is an international organization whose main focus with their products and benefits is around women who are going through maternity or just given birth. And with Parent Sense, members on Discovery Health Medical Scheme who have activated their maternity benefit, they will be able to download the Parent Sense app through the Women's Health Hub. This is at no cost as a Discovery Health member. And really what the Parent Sense app does is it provides you with additional support as an expecting mum or a new mum, where, as you can see through the Parent Sense app, you have access to vaccine schedules, sleep routines, guidance on breastfeeding and bottle feeding. Daily play activities is also part of the features that you can find through the Parent Sense app. Then I think one of the biggest updates, and this really hasn't been something that's been a focus area for a long time, but we have now seen the need to include this in our benefits. And we've partnered with the Stellar app to bring you the personalized menopause care benefit. The Stellar app will be available to download through the Women's Health Hub on the Discovery Health app. Again, it comes at no cost for Discovery Health members, and it really is available to support members who are going through pre-menopause or going through menopause. And through the Stellar app, Discovery Health members will have access to one-on-one coaching support, virtual consultations with GPs who are trained in menopause care, as well as supportive online communities available through Stellar as well. We think this will give our members going through menopause a lot more support to assist them with managing this condition. And then just some of the additional benefits available to all Discovery Health members. A lot of people don't know this, but as a Discovery Health member, you get a healthy care benefit through Clicks and Dis-Chem, where you get up to 10% back on your personal care items. And the list is really a really long list. There's literally thousands of items that you can get this cash back on. But if you would like to make use of this benefit as a Discovery Health member, you just need to activate the benefit through the Discovery website. You also get a 20% discount on frames and lenses at Network Optometrists, and stem cell banking is also available to you at a discounted rate. So if you would like to store your newborn baby's umbilical cord or stem cell tissue for future medical use, you can utilize this at a discounted rate through Discovery Health Medical Scheme. And if you haven't downloaded the Discovery Health app yet, this is your moment to scan the QR code and download the Discovery Health app. The app has various features, and I'm going to talk through some of them with you now. But I think also importantly, with some of the enhancements for next year, it will be critical that you do make use of the app in order to access some of the benefits. The app on the left-hand side of the screen is features that has been made available for quite a while now through the Discovery Health app. You can literally order medicine through the Discovery Health app and have it delivered to your door. You can manage your health plan, things like your tax certificates, membership certificates. You can view your claims, submit claims, check up on your benefits. You literally can do all of those things through the Discovery Health app. On the right-hand side of the screen is some of the new features and tools that we've made available. Right at the top of the screen, virtual urgent care is now available through the Discovery Health app. This really is access to a healthcare professional 24/7 online through this tool. It's very, very simple to use, and it puts you in touch with a doctor almost immediately, regardless of the time of day. For virtual urgent care, you are covered for 4 sessions per family per year. Thereafter, these sessions do fund from your medical savings account. We've also very recently introduced the virtual physical therapy. You have access to a virtual physical therapist through the Discovery Health app. This is funded through your medical savings account, but it literally gives you access to use a physio, and that's in the palm of your hands. And then most recently, we've updated the Discovery Health app to also include digital mental health care. We've partnered with Silver Cloud, which provides you with so much of support through the Discovery Health app. If you are diagnosed with depression and you are registered on the PMB benefit, then these benefits through the digital mental health program are funded through PMB. But if you are not registered on the PMB benefit for depression, then these will fund from your available medical savings account. What you see on the screen is the actual view of these 3 new tools that we've introduced. On the left-hand side of the screen, you can see that on the home page, there's a Speak to a Doctor Now button. You click on that, there's 2 questions you need to complete, and it literally connects you to the doctor. On the center of the screen is what the virtual physical therapy looks like through the app. And then on the right-hand side, that's a view of the digital mental health care system through the Discovery Health app. That brings me to a brand new product that I would like to introduce you to, called the Active Smart Plan. Very earlier on in this presentation, I did mention that there was a huge decline in the number of young professionals within the open medical scheme market. And really, this is our aim at attracting those young professionals back into the open medical scheme industry. The research shows that these individuals are looking for plans that are affordable, they have specific healthcare needs, and they also prioritize lifestyle and wellness. With that, we've introduced the Active Smart Plan. The plan comes in at a very competitive price of 1,350 rands per month per principal member. The plan will obviously have your core benefits included, like your hospital benefit, full cover for emergencies in hospital. There is financial protection where we apply a deductible of 7,500 Rand on elective procedures. And as this plan is designed for young professionals, the maternity and oncology benefit is at a PMB level of care. We've also introduced customized day-to-day benefits into the Active Smart Plan. Members who choose this plan will be able to access a GP. There's no overall limit for GP consultations. We've included the dental and eye checkup. Over-the-counter medication is included as well. And with the introduction of the Personal Health Fund, members who choose an Active Smart Plan will have the ability to accumulate up to 1,000 Rand per adult in additional day-to-day cover. The next slide really just gives you a breakdown of all of the benefits included in this plan. And you can see that the GP visits, optometry, I've mentioned a few of them. They do have your co-payments that apply for each of these consultations, very similar to how the rest of the Smart Plan series works. With the Essentials Active Smart Plan, though, there are some exclusions which really align with the exclusions on the Essential Smart Plan. We have introduced 3 new exclusions with tonsillectomies and the other 2 that you can see at the bottom of the screen. And there is a neonatal admission limit of 70,000 Rand per family. Members who choose the Active Smart Plan will need to make use of the Dynamic Smart Network. The Dynamic Smart Network is really a sub-network of the Smart Network of hospitals. But if you choose the Active Smart Plan, in order to access a Dynamic Smart Network hospital, you will need to log into the Discovery Health app. You'll need to utilize the Find a Provider tool. And based on your reason for admission or the type of specialist or doctor that you're trying to consult with, the app will usher you to the closest smart network hospital. And that really is the smart plan. very similar to the plans within our Smart series, just coming in at a much lower price point, trying to make that plan a bit more affordable for the younger professionals. The next slide just gives you a view of our the service experience that we've provided over the last year or so. Not going to spend too much time on this slide. I think it really speaks for itself. There's three categories that we're looking at: provider categories, which is our healthcare providers, brokers, and then employers. And you can see what our ratings look like across the board. I think overall, Discovery has received quite a bit of recognition within the industry. And the last section I'll be talking through is our integrated products, starting with the gap cover product. Discovery's had the gap cover products running for quite a while with our gap core and gap comprehensive options. Gives you an additional 250% cover for specialists in hospital, or 500% if you choose the comprehensive option. You can see the price points at the bottom of the screen. Really, what I'm going to talk to you about today, though, is the Gap Active, which is a brand new product that we've introduced. The Gap Active is essentially designed to go hand in hand with the Active Smart Plan. So members who choose the Active Smart Plan can also look at taking out the Gap Active. If you're under the age of 30, it comes in at a price point of 49 rands per month for the principal member. And the Gap Active gives you an additional 100% cover for specialists in hospital. If you're on an Active Smart Plan, essentially you'll be covered up to 200% for specialists in hospital. And then it also provides you with cover for those deductibles up to 7,500 Rand. And that really is the Gap Active. It's a very simple product designed to go hand in hand with the Active Smart Plan. And then just lastly, our Vitality shared value business model. Vitality has obviously been around for quite a while. It is our wellness program. It encourages you to be active, to make healthy choices. It has mechanisms in which it monitors the behavior, and then it rewards you for that behavior with various discounts through travel, cashbacks on your healthy food, discounts on your healthy gear. We have hundreds of partners now with us. In terms of Vitality enhancements, I think the biggest enhancement is we've introduced a new healthy food partner. You might have seen it on social media. Checkers is now part of our healthy food benefit. And with the introduction of Checkers, we've also included online healthy food partners with Checkers 60/60 as well as Woolies Dash. If you haven't linked those new partners to your Vitality policy, you can do so on the Discovery Health app. For Checkers, you will need an extra savings card that's linked to your ID number in order to activate the benefit. And then we've also included a paddle gear benefit. Members who buy paddle gear through the Sportsman's Warehouse or Total Sport partner stores can expect to get a 50% discount on their paddle gear that's purchased. And then another big update is the Vitality Fitness Partners. That's accessible through the Discovery Health app as well. With the Vitality Fitness passes, you can book class bookings, access passes through the Discovery Health app. The access passes are available through Virgin Active and Planet Fitness. As a Vitality member, you get 3 free visits once off with these partners. On the right-hand side of the screen is just literally the steps you would take when booking an access pass through the Discovery Health app. And you can see you select your fitness facility, choose the access pass or the package that you'd prefer. It creates a QR code and you present that QR code at your Virgin Active or Planet Fitness in order to gain access. And then another big update for Vitality members is we've partnered with the United Airlines. This essentially means that members who book a flight to America through the Vitality platform can now expect to have direct flights through United Airlines. Previously, we would use connected flights, so the layovers would always be really long. But from October this year, United Airlines is now part of the Vitality family, and you can expect to book those direct flights as a Vitality member. Vitality has done quite well over the year. We've included the slide just to give you a view of some of the data we've got from Vitality. The Cashbacks members earn on average per month just under 800 Rand. It's significant because you pay about 400 Rands a month to have the Vitality policy. So I think that says that Vitality really does pay for itself. The chronic ratio with our Vitality members is 24% lower, and we also find that Vitality members are 46% more physically active. And then just lastly, an exclusive offer to all Discovery Health members. If you are not a Discovery Bank member, you can access the Discovery Bank platform, and the Discovery account, which is the blue account that you see on the screen, is available to you with no monthly fees. The benefit to you with having a Discovery Bank account, especially with the introduction of personal health pathways next year, you'll find that you are going to be receiving a lot of Discovery miles by achieving those weekly goals. You don't need a Discovery Bank account to use up your Discovery miles. You can use them through the Discovery Health platform, but by having a Discovery Bank account, it literally increases the value of your miles. And this exclusive offer is only available to Discovery Health members, where you can join Discovery Bank and not have to pay any monthly fees. And that really brings me to the end of my part of this presentation. Thank you so much for your patience. Dom, I can hand over to you now.
Thanks, Zane. Zane, there are one or two questions that I think you should maybe answer.
Yes.
Okay, need to stop sharing.
Where's my screen? There we go.
So the first is the personal health pathways. How would
Yes.
that be activated?
Personal health pathways. So you would need to download the Discovery Health app. And when you download the Discovery Health app, after you've logged in with your username and password, you'll find on the home screen a prompt to activate personal health pathways. You would very simply click on that prompt, and the rings that I showed you a bit earlier would come up on your screen, and it will give you an indication on that screen what your health action and exercise action is.
Great. If you have the Discovery Health app, that will be an automatic upload,
It
correct?
will be
As soon as we have an update, it'll automatically show.
Correct, yeah. And at the moment, it is available for Discovery Health staff, so it's sort of in a testing phase. But 1 January is the set go live date for Discovery Health members.
Okay, great. And the other question that I have is on the Wealth Fund. People they can access it now. So if they haven't activated, they do their wellness test now, it would still be available until the end of this year.
Correct, that's right.
Okay. And one more question on the personal health pathways, things like co-payments when you have a co-payment on either your medication, your chronic, or when you have a classic smart co-payment, it's not going to pay that, correct? It's just going to pay things that, for instance, would be paid from your medical savings account.
Correct, yeah. It won't fund your co-payments, and claims that are paid from the personal health fund are also paid up to the Discovery Health rate. So if you had to visit a GP, and if that GP charged more than medical aid rates, it will pay from the personal health fund, but it will still pay up to the health rates.
Fantastic. Okay. Thanks very much, Zane.
Pleasure.
Okay, everyone, please continue to put your questions into the chat group. If we don't get to them during the presentation, we will definitely answer afterwards. So feel free to put your email address. We'll happily come back to you. I'm not going to take a lot of your time. I'm just going to give you a quick summary now on your actual options going into 2025. Just a quick summary. I know Zane's taken you through a lot of information this morning. So just to have a look at your structures of your benefits, obviously you have hospital cover. Please do remember for things like your plan procedures, you do need authorization. Rule of thumb, 48 hours before you go into a hospital, please have your authorization. Emergency is deemed as a life-threatening emergency. So that is something that is life-threatening, loss of limb, loss of use of limb, need treatment right away. And also be very, very aware if you have to use a network hospital. There are plans that have network, so any plan that has the word Delta, Coastal, or Smart in front of it, you are required to use network hospitals for your planned procedures. As Zane mentioned, they've introduced the Smart Active, and one of the things that you will see with the Smart Active is that for all non-emergencies, there is a 7,500 co-payment if you go into hospital. Gap cover is becoming more and more prevalent in South Africa. Yes, your hospital does its best, or your medical scheme does the best cover it can offer, but because our doctors can charge you whatever they want, and we are seeing more and more co-payments coming, especially in your network and low cost options, we do suggest that you consider taking out a gap cover. A gap cover is a short-term insurance that allows you to cover things like shortfalls on your doctor's accounts in hospital. Please bear in mind that gap cover is focused on in-hospital shortfalls. We get a lot of calls that say, well, I've run out of my savings. Can I claim back from my gap cover? The main focus is in-hospital shortfalls, co-payments and deductibles, and out-of-hospital things like casualty. Casualty is your out of network or out of working hours visits to your casualty. My son has broken his arm, now needs to go and have a plaster Paris put on, x-rays. It's 9 o'clock at night. My GP is not open. Remember, you are not physically being booked into hospital. That is going to come from your day-to-day benefit. There are a lot of gap covers out there that would offer you a casualty benefit. And once again, if you are looking at that Smart Active plan, there is a co-payment of 7,500 Rand for anything other than emergencies. So please ensure that you cover yourself. The Discovery Gap Cover, the Gap Cover Active that they've brought in at 49 Rand for your youngsters is a very good option for that product. If we move on, Zane gave you a lot of information on the chronic cover. Once again, please remember you do need to be registered for your chronic benefit. It is not an automatic benefit. So if my doctor decides that I need to take medication for asthma, he does need to register me. And very importantly, I do need to choose a primary care GP for my chronic cover. Very important, please register because you also get treatment plans as Zane explained. So for instance, every year or every 6 months, I have to get an updated script. If I just phone my doctor at the moment, they're charging 150 Rand for a script. Whereas on my chronic medication, I can actually go and see my doctor, have a consultation, have any test related to my chronic and have it covered from my chronic benefit. Day-to-day cover on Discovery comes in what I call different flavors. If you are on the core plan, you are on a pure hospital plan. This plan only offers you hospital. It does not offer you day-to-day cover. The Key Care and Smart plans offer you cover that is network driven, so there is no savings account. Your Saver plan is a hospital plan with a savings account, and your Priority and Comprehensive plans are your higher options that offer you day-to-day through 3 benefits. The first is your medical savings account, your second is your self-payment gap, and your third is your above threshold benefit. If you are on a priority or comprehensive plan and you haven't reached your above threshold benefits, in the next few weeks, you will be getting letters from NMG just advising that it might be worthwhile to consider your actual options. So all the plans do cover maternity. This benefit has been around for many, many years. So it's just a reminder, this benefit is also something that you need to register for. You need to register on the Discovery app, either using the My Pregnancy and My Baby programs on the Discovery app. It is once again not an automatic benefit. Right, our option summary. We have the top options, which is your classic comprehensive. They're your executive plans, your executive and classic comprehensive and classic smart comprehensive offer very, very high oncology benefits. They also offer high day-to-day benefits. Your classic comprehensive and your executive option offer 25% medical savings account, whereas your Smart Comprehensive offers 15% medical savings account. Guys, if you're on these options, you are either a high day-to-day claimer or a high oncology claimer. If you are on the Classic Comprehensive or the Executive option, you do get cover for 50 chronic conditions. If you are on the Classic Smart Comprehensive, you get cover for 27 PMB chronic conditions. The priority plan is your next step plan. This plan is a 200% plan if you're on the Classic Comprehensive, 100% if it's essential on hospital, 27 chronic conditions. The big difference on this plan is that there are deductibles. This is the only plan that has deductibles. These are upfront amounts payable when you go into hospital for certain procedures. Once again, this is only on planned procedures, not on emergencies. These deductibles range from 4,800 to 22,850 Rand. Please note, we get a lot of questions from members that says, I have 20,000 Rand sitting in my savings. I'm on the priority plan. I need to go for a tonsillectomy, but they now say I must pay 4,800 Rand. Because it is a deductible, you cannot pay it from your savings. Co-payments can be paid from your savings. Deductibles need to be paid from your pocket. Once again, if you take this plan, we highly suggest that you look at taking a gap cover. This is the only plan that has deductibles. Moving on to the Saver and Core plan. Your Saver plan, once again, is a plan that has a hospital plan and savings account. Please remember, all your plans that have savings, if you don't use your money, it rolls over to the following year. You never lose that money. 27 chronic conditions covered on your savings options. On your Saver plan, you have the Coastal Network. Our agreement on Coastal plans is for any planned procedures, we will do them in the Coastal Network. That is KZN, Western Cape, and Northern Cape. On the Core option, these are pure hospital plans, so they only give you cover for in-hospital. Please note, big thing on a Core option, they do not cover out-of-hospital MRI CT scans. So in my case, I have very bad knees. Every 6 months, I need to go for an MRI CT scan. It is not in hospital, so I'm not booked in for a procedure. If I am on the Core option, this will be paid from my pocket and not from my hospital benefit. The Smart plans, these plans are digitally driven. So on the Smart plans, effectively, you do not receive membership cards. You can request membership cards, but effectively everything is driven through your cell phone. The Smart plans offer you GP visits, however, it is through a network of GPs. So it is called the Smart GP network, and you have unlimited network GP visits, but depending on which option you take, you have a co-payment. The Classic Smart is the top Smart option. This offers unlimited network GP visits at 70 Rand co-payment. An eye test, please note, all of these options offer an eye test. However, if you need glasses, contacts, or anything else, you will pay for that yourself. It is only the eye test that is covered. Dental checkups work the same. They will cover a portion towards the dental checkup, but if I need a fillings, extractions, etc., I will pay for those. The Classic Smart also offers a sports injury benefit, an over-the-counter medication benefit, and acute medication benefit. On the Essential Smart, Essential Dynamic Smart, and Active Smart, you do not have access to the sports injury benefit or the acute medication benefit. They do, however, offer an over-the-counter medication benefit, the dental checkup, and the eye test. Please note, if you take the Essential Dynamic Smart, Essential Smart, and Active Smart, there are exclusions such as joint and back surgery, which is excluded on these options. These are for your young and healthy members, and there are exclusions applied on the hospital. So before you take them, please do ensure that you understand those exclusions. On the Essential Dynamic Smart and the Active Smart, in order to access your hospitalization, you will need to contact Discovery, and they will determine which hospital you will go to. So you will access the Dynamic Smart Hospital Network via the Discovery app or the Discovery website, or you will contact Discovery and they will determine which hospital you go to. Please know that once again, if you have a plan that has a network hospital, if you willingly choose not to use the network, you will have a co-payment that will be applied or a deductible that you will be forced to pay towards that procedure. Looking at the key care plans are the plans on Discovery that effectively are income-based. So these are cost-effective income-based options and take into account your gross salary. Your gross salary will determine what amount you pay towards these plans. The Key Care Plus, Key Care Start Regional and Key Care Start Regional all offer day-to-day benefits. These are also network driven. Your day-to-day benefits are all through primary care providers. The best option on these plans is the Key Care Plus. This offers you unlimited GP visits, acute medication, specialist visits, unlimited dentistry, and optical all through network providers. The main difference between the Key Care Plus, Key Care Start, and Key Care Regional is your GP network and the hospitals that you can use. The Key Care Core is the pure hospital plan. So the only day-to-day benefit on the Key Care Core is that you have access to the specialist benefit on the Key Care Core, but you do not have GPs, medication, dentistry, etc. If we look at your rates going into January 2025, these are your rates. Once again, if you are on a corporate company, it doesn't take into account any subsidies, etc. You have the main member, spouse, and child. Please remember, any child over the age of 21 will pay an adult dependent rate. Any child below 21, we build at a child. On all of the Discovery options, you pay up to 3 children, and your savings is already included in this contribution. Looking at the Key Care options, you'll see that the Key Care is income banded. So once again, it takes into account your monthly salary. So if I look at Key Care Plus, if I'm earning 16,000 Rand, I will pay 3,687. If I'm earning 8,000 Rand, I will pay 1,817 for the same benefits. If you do choose Key Care for next year, or if you are currently on Key Care as an individual, you will be required to do a Key Care income verification. This is an online questionnaire that you will need to fill in. Discovery will send you an email reminding you to do that. Please ensure that you do it, because if you do not do the Key Care income verification, you will automatically be put onto the highest income. Zane mentioned the changes on Vitality. So Vitality rates increase from effective 1st of January 2025. Guys, my suggestion and advice to you is if you're not getting your Vitality rate back, so at the moment I pay 399 Rand to Vitality, I ensure that I at least get 450 Rand back on Vitality, because that covers my Vitality rate. Please make sure that if you've chosen to take Vitality, you at least get 399 Rand back every month. Then it makes Vitality worthwhile for you. I've had a few questions of what do we do going forward. So going forward, well, first of all, we have a complaints procedure. We try as much to give you as much information as possible. Obviously, time is limited. So if you do want to have any consultations, you're more than welcome to contact NMG. I've had a few people ask us, what do we do? How do we change options? We do have the NMG portal that's available to you. You're more than welcome to go onto the NMG portal. You do have NMG consultants allocated to look after you. You're more than welcome to contact us to assist. If you want someone to contact you and you're not sure who your NMG consultant is, please put it in the chat. I'm happy to answer any questions, but put it into the questions. We'll happily contact the consultant and get someone to contact you. Once again, remember, you can downgrade any time during the year, but this is the time to look at your options. Anyone who tells you that a medical scheme is cheap doesn't know what they're talking about, but this is the time to ensure that you're on the best plan. You cannot go up during the year. So we have a lot of questions of, well, I'm going to choose the cheap option now, and then in 2 months' time when baby's born, I'm going to go up to a higher option. You don't have the option to do that. You need to choose your option correctly now, and this is the time to talk to us. Okay. Zane, are there any questions? I know I went through that very, very quickly.
I have answered most of the questions in the chat. There was a question that just came in now. We are on the comprehensive plan and would like to sit with a consultant at Discovery head office in Sandton to go through our plan, please. How do we book this? maybe you could just advise on anyone that wants to consult with NMG. How can they go about setting it up?
Yeah. So remember, Discovery is not able to give you advice. So I would suggest that you arrange it with NMG. So if you want to pop me your email address, I will make sure that someone contacts you. We've got 2 offices in Joburg. We've got Braam and Bryanston. Braam and Bryanston, Randburg. Sorry, I'm based in Cape Town. But I'll make sure that someone contacts you. That's the big thing. A lot of people think Discovery can give advice. Discovery can't give advice. They can only give you factual information. So it's NMG who can assist you with plan choice. We can also access your data for the last 7 years. So I'm happy to arrange for someone to contact you and set up an appointment for you to come and see them and sit with a consultant. Okay.
Thanks, Dom.
Great. All right, we'll leave it open for a few minutes. If there's any other questions, please feel free to post. Otherwise, thank you very much, and have a wonderful weekend, everybody. Thank you for your time.
Thanks, everyone.